Thank you, Mr Holyburn. It's a great pleasure to serve under your chairmanship, and I beg to move that this House has considered social care in Liverpool. Mr Holyburn, this is the third occasion on which I have raised the issue of adult social care in Liverpool in this place over the past 2 months. This is because major cuts in government funding, combined with rising needs, are creating a situation where too many people are left feeling vulnerable in their own homes, and scarce hospital beds are occupied by people who are clinically fit to be discharged but cannot leave the hospital because social care is not available. This is bad for those individuals, and it's bad for the National Health Service. I do realise that this is very much a national issue, but this debate puts the focus on Liverpool and the specific challenges that Liverpool and indeed the Liverpool City region faces. Mayor Anderson and Liverpool City Council have done their very best to protect the people of Liverpool from the impact of unprecedented government cuts. But adult social care has not been able to escape the consequences of this government's actions over a long period. Adult social care covers a wide range of services. They include domiciliary support, and that means helping to dress, feed and bathe people in their own homes, and where appropriate, ensure that correct medication is taken. Depending on the individual's situation, this could involve several visits a day to an individual's home. In other cases, it might require one visit a day. But whether it is one visit or several visits, it is absolutely essential to allow that individual to lead an independent life. The provision of adequate adult social care does enable many people to remain safely and confidently in their own homes rather than feel vulnerable and rather than move to a more expensive and much less satisfactory residential care. It can bring peace of mind, and indeed it is a lifeline. But let's look at what's been happening to funding in Liverpool City Council. Liverpool has now lost 60% of government revenue support since 2010. And by 2020, this figure will rise to 68%. Indeed, the government, in looking at revenue support systems, plans to eliminate revenue support entirely in a new funding settlement. This will have very serious consequences for a city with a low tax base, where 80% of its population are in council tax bands A and B. Liverpool Council is a very responsible authority, and it has already identified £90 million of additional cuts it is required to make in the coming financial year. The Council continues to do its best to protect services, but it has not been able to stop substantial cuts in its spending on adult social care. This has been reduced from £220 million in 2010 to £154 million in 2016. And it is anticipated this will be reduced to £130 million by 2020. Yes, the government has its Better Care Fund, and yes, the local authority does have a limited ability to raise an extra precept. It is apparent that the government's Better Care Fund is expected to allocate £39 million to Liverpool at the point that its funding will be reduced in this very significant way. And that will leave a massive gap. Neither the government's Better Care Fund nor the Council's ability to raise extra tax can fill the gap caused by the withdrawal of central government funding, and the scale of that withdrawal is unprecedented. At the same time as the government is reducing its support, both demographic pressures and costs are increasing. The Office of National Statistics estimates that the percentage of people in Liverpool aged 65 years or more will rise from 14.6% of the population in 2015 to 16.1% in 2024. It is wholly unrealistic to expect people in the fourth most deprived local authority in the country to fill the gap. The sums simply do not add up. And just to illustrate the situation, a 1% increase in council tax in Liverpool will raise £1.4 million. A 1% cut in central government funding means a loss of £3 million. A totally unacceptable situation, and one that cannot continue without inflicting severe cuts on services which are very important indeed to the people of Liverpool. And I did say that Liverpool is the fourth most deprived local authority in the country, and that is correct, and there is great poverty in the city. But Liverpool City Council, through its pioneering spirit, its enterprising approach, and its ability and willingness to innovate and work with others, has in fact been able to move Liverpool from being the most deprived local authority in the country down to that number 4. Now, it's very bad to be the fourth most deprived, but I think it is a tribute to the City Council and its partners to see how they have been able to make progress in Liverpool. But with that progress, we haven't had proper funding from government. Indeed, that has reduced, and that is the critical feature. Already, social care packages in Liverpool have been cut from 14,000 to 9,000. This has affected many vulnerable people, and many more are anxious. There are many people who are in great need, who are being reassessed to see if the care they currently receive can be maintained. That often induces great anxiety and apprehension, even if ultimately their care remains very similar to what it was. And that too is a very important factor, which I don't think is always considered. On the day that I visited the Royal Liverpool University Hospital, 135 patients who were clinically fit to be discharged remained in their beds because social care was not available for them at home. And that was despite the efforts of staff, both in the hospital and in the local authority, to try to find suitable care packages for them. The money simply was not there. And that figure, which was an accurate figure for the day on which I visited the hospital, in fact reflects the general situation and shows one of the problems that we're finding because of the cuts in social care in Liverpool. And those cuts arise solely because of cuts in government funding. This situation is affecting many people, and it can only deteriorate unless action is taken. Well, what should be done? Let's look at what's happening now. Mayor Joe Anderson, Cabinet Member Paul Brandt and Liverpool City Council as a whole must be commended for the work that they are doing in promoting partnership with the NHS and promoting innovation. This involves new work, which involves working with the clinical commissioning group and with GPs in trying to integrate health and social care. Step-up centres for intermediate care are being pioneered, and the Council also plans to promote pioneering joint work with community health services. A joint working party is considering new ideas. All of those things are extremely important, and all of those demonstrate the willingness of the City Council to innovate and to work with other partners. That work itself should be supported better by central government. But whatever innovation is taking place in Liverpool, however much the Council is willing to work with other people and work for integration, ministers cannot escape the fact that more funding is needed. This is a long-term issue, but there is a crisis now, and immediate action is required. It is a crisis that Liverpool City Council cannot resolve on its own, and neither can the people of this city fill the financial gap unaided. I call on the government to recognise its responsibilities and announce an immediate allocation of targeted funding for adult social care in Liverpool. I do recognise that this must be part of a national approach, but funds must be targeted to meet the needs of local communities. This will enable vulnerable people to live independently and safely in their own homes, as well as enabling the NHS to deploy its resources efficiently. Liverpool City Council should be congratulated for the resilience, innovation and flexibility it has displayed, but it cannot resolve this crisis alone. I call on the Minister to act as a matter of urgency.